Hello, my name's Hudson Garrett, and I'm an adjunct assistant professor of medicine in the Division of Infectious Diseases at the University of Louisville School of Medicine. And it's my pleasure to bring you this video introduction for our November Aerobotics clinical feature article. This article focuses on an area that I think is near and dear to our hearts, which is really addressing the four common sources of contamination, as well as reducing the risk for healthcare associated infections in clinical patient care environments. First and foremost, historically, as a field, we have focused on the contaminated hands of the healthcare provider and also the patient. That second layer of complexity is looking at the clinical environment of care, the medical devices, the equipment, the surgical instrumentation, as well as the surfaces that are used in delivery of patient care. The third area that directly impacts perioperative care in particular is the clinical microbiome, the skin of the patient. And that's also internal and external. So think about prophylactic antibiotics as an example. Also the skin antisepsis, the clipping that we do in the OR. The last one, though, is a new one that has been introduced in the ARN sterile technique guidelines, which is the role of the contaminated air in the healthcare environment. This is an area that I think has huge implications for us, not just from a patient safety perspective, but equally important from a healthcare safety perspective. I hope that you enjoy this article and find it useful, and I look forward to seeing you again in December.